Good, happy Thursday evening, March 12, 2020. I'm Riley King, and welcome to this Thursday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday evening, so let's begin. First up, sixth person in New Hampshire tests positive for COVID-19. Rockingham County man self-isolated after returning from Europe, health officials say. Let's take a listen to that video from WR News 9.
Hi, I'm Sherry Allen, proud owner of Mercedes-Benz in Portsmouth. We put every effort into making Mercedes-Benz.
And we begin with breaking news this noon. A sixth Granite Stater has just tested positive for COVID-19 in New Hampshire. That announcement just being made in the last hour. Good afternoon, I'm Mike Cherry. Now, according to officials, a man from Rockingham County who traveled to multiple countries in Europe has the virus. They say he did self-isolate once he returned from Europe and got tested when he developed symptoms. Members of his household have also self-quarantined.
Okay, and there you go on that video and that report. Again, that sixth person has been tested positive for COVID-19. Let's take a look at the COVID-19 graphic. Here is where we stand for COVID-19 in New Hampshire. Number of 6 people in New Hampshire who have tested positive for COVID-19. 127,863 number of people worldwide who have tested positive. 0 number of deaths from COVID-19 in New Hampshire. 38 number of deaths from COVID-19 in the United States. 4,718 number of deaths from COVID-19 worldwide. You have 3 people in Grafton County that have it, and 3 people in Rockingham County that have it. The common symptoms: fever, cough, and difficult breathing. How it spreads. It's unclear how easily COVID-19 spreads. Human coronavirus commonly spreads through respiratory droplets from coughing or sneezing through close personal contact, such as touching or shaking hands, or touching your face, eyes, or mouth after touching a surface with the virus on it. Prevention tips: wash your hands often with soap and water for at least 20 seconds. Do not touch your eyes or mouth with unwashed hands. Avoid close contact with people who are sick. Cover your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue in the trash can and wash your hands. Clean and disinfect objects and surfaces. Stay home from work or school if you have a fever or are not feeling well. Parishioners told not to attend Mass if sick. Priests instructed to use proper hygiene before service. Let's take a listen to that video from WR News 9. Sorry about that, we do not have a video for that. The Diocese of Manchester are telling parishioners that they should not attend Mass if they're sick. Bishop Pete issued updated guidelines Thursday that noted that parishioners aren't obligated to attend Mass if they're sick and should stay home instead. The diocese also suspended coffee socials and other gatherings after Mass and suspended distribution of Holy Communion via Catholic. Priests and lay ministers were also told to practice good hygiene, including washing their hands before Mass and before and after distributing communion. The diocese said Catholic schools are preparing for the possibility of closing schools by training on Google Classroom to instruct students remotely. Upcoming New Hampshire Superior Court jury trials canceled over COVID-19 concerns. Civil criminal trials scheduled for next 30 days to be rescheduled. All criminal and civil jury trials in New Hampshire Superior Courts scheduled for the next 30 days have been canceled because of public health concerns over COVID-19, court officials announced today. Superior Court Chief Justice Tina Nadia said all jury trials for the next 30 days beginning Friday will be canceled and rescheduled to later dates. Court officials said anyone set to appear for jury duty should not go to court. All jury duty reporting dates between Friday and April 13th have been canceled. Anyone with a later date should check the New Hampshire Judicial Branch website for any updates before reporting. Anyone involved in upcoming trials will be notified of a new trial date, officials said. The 30-day period could be extended if needed, officials said. Anyone affected by an extension will be notified. Report: Boston Marathon organizers will postpone race, eyeing September. Organizers of the 2020 Boston Marathon will postpone this year's race amid concerns about COVID-19, sources told WCVB Boston. The 124th running of the world's oldest and most prestigious marathon was set for April 20th, Patriots Day. Organizers are now looking to reschedule the event for September, although an exact date has not been determined, sources tell 5 Investigates. Legislators are talking about creating a special holiday in the fall in order to have the marathon be held on a holiday, WCVB has learned. The bill would be subjected to the same approval process as other bills. A formal announcement is expected in the next day or two. Schools in New Hampshire. 2 New Hampshire districts closed amid concerns over coronavirus. Let's take a listen to that video from WMUR News 9.
The New Hampshire Community Loan Fund is tackling some of the Granite State's most urgent needs, like affordable housing for our state's working families, seniors, and young people. Your donation to the Capital Impact Challenge can have a profound impact. Give today.
Following some breaking news, the Governor Wentworth School District is closed today because a relative of a staff member is being tested for COVID-19. The superintendent tells us the staff member does not have symptoms, but the whole family is under quarantine. At this point, it's unclear if the district will reopen tomorrow.
Okay, and there you go on that video and that report. New Hampshire colleges announced policies around spring break and COVID-19 concerns. University System of New Hampshire issues guidelines for its campuses. Let's take a listen to that video from WMUR News 9, Ray Brewer.
At Southern New Hampshire University, all in-person classes are now suspended. The university is currently on spring break, but in a letter, officials say they're moving instruction online to protect the health of students and staff from the coronavirus. The university going on to say there are currently no confirmed cases on the SNHU campus or any of the office locations. The online instruction is scheduled to last through March 29th. Other institutions have put in place similar restrictions. The Tuck School of Business at Dartmouth is moving its classes online for the first 2 weeks of spring term. That begins on March 23rd and affects approximately 40 MBA classes. This comes as Dartmouth has issued guidelines calling for all events involving 100 or more people to be canceled through April 17th. The admissions tours are also being suspended. At Keene State College, students will be allowed to return to campus as usual after spring break, which starts tomorrow. However, the college is not going to return to face-to-face instruction until April 6th. The reason? The college says that some in the college community will be restricted from returning to campus. The University System of New Hampshire has told students and staff who travel outside of North America, go on a cruise, or visit any part of the U.S. that has more than 100 cases of COVID-19, including New York City, Seattle, and San Francisco, that they will have to self-quarantine for 14 days upon their return.
All the colleges and universities say that this remains a very fluid situation, that these dates and practices could change as more information becomes available. Reporting live at Southern New Hampshire University, Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. Massachusetts has reported 13 new coronavirus cases in the past 24 hours. 5,000 new test kits delivered to state lab. Maine has first presumptive case COVID-19 in the state. Remaining passengers on JetBlue flight from New York released. A passenger who arrived at Palm Beach International Airport tested positive for coronavirus. Let's take a listen to that video from WPTV, Florida.
A record 34 times? Honda. Who has KellyBlueBook.com chosen as a best buy? Honda. Buy the best, drive the best. Test drive an award-winning Honda at your local Honda dealer.
In Palm Beach County, a man who tested positive for coronavirus, he flew in on a flight last night from New York. Passengers had to be held there at the airport before they were finally released today. WPTV News Channel 5's Matt Cesney, he's live at the airport this afternoon with how the airline is responding to all of this. Matt?
Shannon, it was a JetBlue flight, and in a statement today, JetBlue says they thoroughly sanitized that plane and the terminal. They are also asking any passengers who don't feel well not to fly, and they are waiving any fees for canceling. Meanwhile, today, one man who was on that plane, sitting in the same row as the man who tested positive for coronavirus, wonders today if he has the virus.
It has me upset. It's very frustrating.
Scott Rodman spoke with us by FaceTime from his parents' home in Palm Beach County. Self-quarantined because he just doesn't know, he says, if he has the coronavirus, after being on the JetBlue plane Wednesday night that arrived at PBI with a passenger that tested positive for the virus.
It was absolutely shocking, especially when I see the news, today, where as soon as we get off the plane, they're sending people on in hazmat suits.
Hazmat crews did spend a great deal of time disinfecting the plane as the 100-plus passengers were released by county health officials and told to monitor themselves.
Most likely you're not going to have anything because there was no activity.
At the airport, some anxious travelers weren't shy about wearing gloves and masks, as others questioned why would a sick person get on a plane at all.
The man was a dummy, inconsiderate. I read there was another guy, a family that was quarantined, and they left. People don't want to do the right thing. That's the problem for everybody.
And Scott Rodman thinks it's now his problem. He's self-quarantined for 2 weeks despite the assurances from the county health director who talked with the passengers.
We were on the tarmac for about 2.5, 3 hours. So I was on that plane for 5, 6 hours with recirculating air with a man who tested positive. And to tell me that it's okay for me to just go home after everything I've read and seen, it didn't seem like the proper advice.
So far today, Scott tells us he feels fine. He is not feeling sick, which is certainly good news. We did try to reach out to Palm Beach County's health director today with calls and emails, but we're told she has been very busy today. We're live at Palm Beach International Airport. Matt Cesney, WPTV, News Channel 5.
Okay, and there you go on that video and that report. We can tell you some breaking news that is coming into our newsroom right now. Disneyland in California has announced they will close starting Friday through the end of March in best interest of guests and employees over coronavirus. Disneyland closing only the 4th time in history the park will close. And now let's take a look at that U.S. stock market and see how your U.S. stock market closed for this Thursday evening. And here's a look at that U.S. stock market for all of you for this Thursday evening. Your Dow Jones Industrial Average closed in the red and went down. Your Nasdaq closed in the red and went down. S&P 500 closed in the red and went down. Gold closed flat. U.S. oil closed flat. U.S. 10-year closed flat. Euro/USD closed in the red and went down. And VIX closed in the green and went up. Dow plummeted 10% in coronavirus fears for its worst day since the 1987 market crash. Stocks plummeted once again on Thursday after President Donald Trump and the Federal Reserve both failed to quell concerns over the economic slowdown stemming from the coronavirus, leading to a historic drop for the U.S. market. Can the U.S. healthcare system handle the coronavirus pandemic? Let's take a listen to that video from Good Morning America, ABC News.
GMA cover story, more on questions about the coronavirus pandemic and whether the U.S. healthcare system is prepared for a possible escalation. We saw what's happening in Italy, and the big question is, could that happen here, too, in our hospitals? And Steve Ostensami joins us now from outside CDC headquarters in Atlanta. Good morning, Steve.
Good morning to you, George. Here from the CDC, health officials here are warning that hospitals across the country in both rural and urban areas could see a flood of coronavirus cases. Already, doctors from coast to coast are sending emails to their patients warning them not to come into the doctor's office if they're sick with this, but instead to head into the emergency room. Hospitals across the country this morning are bracing for the worst, with tents like these popping up outside emergency rooms. Boston, San Jose, and Salt Lake City setting up what they call surge tents. Inside them, healthcare workers are preparing for potential overflows and the need to isolate people sick with the coronavirus. Some health officials are also worried that there are not enough medical supplies.
I believe that if we have a major outbreak, we are definitely vulnerable to shortages.
Something they need greatly are ventilators to help patients who are having trouble breathing. The 2010 Cambridge study estimated that there were only about 160,000 ventilators in the U.S. that can be put into the field. But based on the current infection rate, the number of ventilators needed in this pandemic could exceed that. Northwell's Plainview Hospital on Long Island in New York says they're prepared, giving GMA a behind-the-scenes look at additional beds and ventilators that they have at the ready.
So when you would come into our emergency department, you would see a typical stretcher that we place patients on. We have equipment to monitor patients' vital signs, and in extreme cases, if needed, in extreme severe cases, we have ventilators if needed, patients in severe distress.
This is why so much stock is being put into social distancing. There is the hope that this will ease some of these concerns.
Flatten that curve. Okay, Steve, thanks very much. Jen Ashton is back for more on this right now. So explain to everybody what we know about our capacity right now.
Well, the short answer, George, is the U.S. critical surge capacity to deal with a public health crisis is unknown. Okay, the last real data came from 2015, 2013, 2010, but I want you to think of 4 S's here because it really depends on these 4 factors. It depends on space, it depends on supplies, so not just ventilators, but other supplies that we use to care for critically ill patients. It depends on staff and systems. There's a lot being made now about the number of ventilators. Ventilators don't run themselves. They need respiratory therapists, they need critical care nurses, and that is really the rate-limiting step in that. So all of these factors have to be taken into account.
And there are so many concerns out there, Doc. What can we do to address these concerns?
Well, look, a lot of that stuff should have been going on in the past. We can address things right now. There's a system or theory called reverse triage. If our healthcare systems and our hospitals become overwhelmed, then it's careful and safe disposition of patients who can go home or can go to other facilities, rooms being transferred from one purpose to another. And I'm sure that major medical centers and hospitals are starting to look at that right now. But that's why it's so important to remember that hospitals generally don't have a lot of free beds. Anyone who's been in one recently knows that. So it's not like they're just sitting there vacant waiting for patients. That's why it's so important on a community level, a population level, and an individual level to take steps so that the patients who need care of all kinds for all reasons in hospitals can still get that care.
Have to get ahead of it.
Yeah, absolutely.
All right, Doc. Thank you so much. Appreciate you, as always.
Well,
Okay, and there you go on that video and that report. And that did it for this evening edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your Thursday evening, and I'll see you back here tomorrow for another newscast. And I'll have a news report coming up in a little bit. Good night and bye, everyone.